Let me go to view.
Yes, we can see you.
We can see you.
Thank you very much. All right. So once again, thank you so much for granting me this privilege. And my mentee, I want to thank you for understanding and for bearing with me. I'm grateful for that. Today, we're going to be talking about fundamentals of research. And I said last week we have been having discussions around introduction to academic writing. When we talk about research, we are talking about a body of knowledge, and we are talking about the nursing profession, how we can validate or refine the knowledge that is in existence in nursing. And it's not just because we want to do research or we want to conduct research like every other profession, but because we want to improve. All right? But because we want to improve the practice, we want to improve the interventions, the quality of care that we give to patients. So we try as much as possible. When we are doing research in nursing, we are conducting the research to understand how we can give effective interventions. So that's what research in nursing it's all about. I'm sure it's not new to you because somehow you have done research, in your schools. All right. Is my slide still on? I guess my slide is off.
No.
It's off.
It's off.
God, please help. Please help us today. I don't want to use the best of the time going off and on. All right. So when we talk about research, it's a deliberate act. It's not just deliberate, it's systematic. And it's not just systematic. You are applying it diligently and you are looking for something, I like to use this illustration. One day I was discussing with my baby son and he asked me a question and I said, why don't you Google it and get the answer? And then he came back to me and said, Mommy, it is research. I said, yes, it is research. And then he said, that means it's in existence before. I said, yes, it's in existence before. And that is, so research is not something that is entirely new. It's something that is in existence before, but instead you are deliberately looking for it. You are going through it systematically, and you are trying to put yourself into it. All right. So when you talk about research, you are investigating the theories that have been used before. You are developing new theories, and then you are using the theory to also be as a framework for your research. Okay, so you use not just the theory, you also use your reasoning, because in research, you have to be able to generate new ideas. You have to be able to understand what has been done before. You have to be able to understand what is lacking before. And that is why we call it research. So if you don't go home with anything today, just understand that research means that you are searching again. You are looking at it from another dimension. Yes, this theory has been existing. Is it still answering what I want it to answer? Or maybe it has answered in the time past questions. But because we are in contemporary age today, it may not be able to answer our question today. So research, you need theory, you need the ability to reason, and you need your ability to use the knowledge that you are finding in generating new knowledge. But it is not going to be easy or interesting if we do not have what you call, if there is no process in it. And if you do not understand the research process, it becomes very difficult for you to conduct a sound research. You know, if you do not have the pathway to pass, then you may not be able to understand basically how you are going to go through the research. So research has a process. Remember, I said it's a deliberate act, it is a systemic way, and it is also diligent, and you are also investigating into something. So you cannot just do it haphazardly. You can't decide that, okay, I'm going to Yaba, but I'll first of all pass through Ikeja, even though there's a straight path that you need to go straight just to get to Yaba, but you wanted to go past anyhow. Research is not like that. The step in the process basically depends on the type of research that you want to conduct. For instance, if I want to explore, I just want to understand what is there. The type of process that I'm going to pass through is different from when I want to intervene in a situation or bring about a change in a situation. So we need to understand what we are going, we want to do for you to be able to apply the right research process. So, but irrespective of what answers you are looking for in research, remember I told you that it's researching. So that means you want to get an answer. So irrespective of the answer that you want to get, there are basically some steps that you need to follow. But the sequence or how the steps are may vary in the different kinds of research. Okay? And so, am I still on? Let me just be sure that I'm still on.
Yes, ma'am.
Yes.
Yeah, okay. Yes, thank you. So we have the background to the study. We have the review of the literature. We have the methodology. We have the results or findings or the analysis. Then when you are finished finding or when you have gotten your results, you need to now discuss what you have gotten. You need to be able to say that, okay, this is the reason why I am getting this result. And then you need to be able to conclude. Now, I want to relate it back to what you did in the last 2 weeks. In the academic writing, basically everybody, conducts research. When you go to the market, you conduct research. In fact, when you want to buy a car or you want to buy a shoe, you want to know the different kinds of shoes that are in existence. And you want to know what the different types of shoes are being used for and what you want to use the shoe for. And so that is where the background to the study comes in. I used to tell my students that from the beginning of your research to the last step in your research, that is, from background to your summary and conclusions, you are going to be reviewing the literature and you are going to be writing academically You are going to be looking out for gaps, and you're going to be filling those gaps. And that is why your research is about, you have to understand what has been in existence. What is this that I want to add to the body of knowledge? What is this that others have done? Because it is when you have a good background to your study that you will be able to understand your statement of problem. So what is background to the study? It describes the study and it sets the stage for what to study. It talks about the problem statement. What is the problem that is existing? It justifies why you want to do the research. It tells you how you want to get solutions to your problem that you have identified. And you're going to talk about the know-how, how you want to do that. And you're going to talk about assumptions, hypotheses, to say, okay, if I do this, this is going to happen. If I don't do this, then nothing will happen. Or if I don't do this, something is going to happen. That is what your hypothesis is all about. And you're going to be saying, in my research, even though we are looking at reproductive age, I want to look specifically at reproductive age from 15 to 30 years old. You are defining your own terms, and that is why it is called definition of terms. And so you're also going to, in your background, you're also going to limit, you're going to tell yourself, this is how far I'm going to go. And you're also going to say, I wish to go this far, but because of this, I may not be able to go this far. Now, let me just quickly go back to the last one, limitation and delimitation. Limitation is actually when you have conducted the study and you encountered some challenges. While delimitation is before you conduct the study, how far are you willing to go so that you do not get into challenges? And so most of the time, I used to tell my students that it is best for you to have delimitation, what some people refer to as scope of the study. It is better you have a scope and tell yourself, yes, I can do the whole of Nigeria, but I do not have the time to carry out my research in the whole of Nigeria. And so I am going to limit myself only to western states in Nigeria. I'm not just going to limit myself to southwestern states. I'm also going to look at only the industrial states in the southwestern states of Nigeria. And I'm going to look at only the major organizations. That is delimitation. But limitation is, I have gone into it, but while I went into it, I was not able to get all my data because I encountered this problem, I encountered that problem. And so at the end of my research, I'm able to tell people that, yes, these are the challenges that I encounter. That is why I was not able to get my answer, the answer that I wish to have gotten for my research. And so most of the time, it is always best to actually have a delimitation rather than limitation. And I used to tell students, don't come back to tell me that it is time factor, because timing may not, may not be a limitation if you have planned your research very well. And that is what we are going to look into today. So, classification of research. When we talk about research, research can go in diverse ways. In fact, like I said to you, everybody everybody, including even the market women, they also conduct research. But we group this different research according to, there are different ways in which we can group the research. You know, under purpose, we can have the basic research and the applied research. The basic research is to discover knowledge purely for its own sake, like those in, like those in pure sciences, like those in chemistry, like those in physics. But when you have applied research, is to obtain knowledge that can be put into practical use, like what we do in nursing. We usually have more applied research because when you conduct a research, okay, for instance, let me use practical terms for nursing. You want to see how best or how fast can a diabetic wound heal if we use a particular solution. And so we try that solution in models, in rat models. And then we bring it into nursing, into the human being. We are applying the knowledge for practical use. That's an applied research. But we also have, according to the level of control, there are two main types according to the level of control. We have experimental research and we have the non-experimental research. Okay? We have the experimental research, which you are able to control. You control everything about the research. And the non-experimental research, you are not manipulating it. Your control is minimal. In nursing, because we deal with human beings, most of the time, we do not necessarily have experimental research as it were. I did not say we do not conduct experimental research, but I say we do not necessarily have experimental research because we are dealing with human beings and we are not camping them in a place. We are not controlling the environment, but those in the basic applied research, for instance, where they use rats and or maybe other models, they are controlling it, or maybe in randomized control trials. Okay, when they have done the modeling in a rat, then they want to create the same situation in human beings, and then they have what you call the randomized control trials. We don't necessarily do a lot of RCT researches in nursing, but that doesn't mean that we cannot engage in such a kind of research. So we have what we call, we can have research according to timing, the time dimension. For instance, COVID is still around, yes, but COVID in Nigeria is not as much as in other places. So, for instance, I want to look at what happened in Europe in 2019 when the COVID started, 2020 at the height of it, 2021 when COVID was gradually going, 2022 when it's a little bit minimal and then we have different kinds of strains. Then I will say I'm doing what they call a retrospective study. I'm doing what they call a retrospective study. I'm looking back. I'm going back in time. Okay? I'm not looking at what is happening now, but I want to see what has happened in that 2019, 2020, 2021, and then I want to see how is it going to affect our future if I say that I want to see how it's going to affect our future, then I'm saying it is prospective. All right? I am looking at the future. For instance, there is this campaign that breastfeeding is very good for children. If I want to debunk, or I want to establish that breast milk is very good for children, and then I group some babies, and then I have another group of babies, and then I breastfeed them, or I allow them to be breastfed completely for 6 months, and then the other group I do not allow them to be breastfed at all, and then I follow them up for like 5 years, and then I look at their intelligence rates, and I said, okay, those people that were actually breastfed, they did better in school. And those that were not breastfed at all, well, they did better in school, but they didn't do as much as those that actually were breastfed. That is called a prospective study. That is, I am following them up. Under these studies, there are still different types of research designs under the prospective studies as well. Then you have what they call the cross-sectional study. What we do, most of the undergraduate students, most of the time, they do what they call cross-sectional studies. During my own undergraduate, I don't know who is trying to mess up with my my slide. The person is trying to write something on it. I don't know what's happening. But yeah, let's continue. During my own undergraduate study, I did a retrospective study because I wanted to know the prevalence and the incidence rate of tetanus and the immunization. So I went to look back into records. I wanted to create a relationship. And so I did a retrospective study. But I'm currently supervising some students and undergraduates that are doing what they call cross-sectional. Cross-sectional study means that I'm carrying out the research now, and I'm cutting across a particular section. I'm cutting across different sections at a point in time T. So we have also the longitudinal, which is like I gave example of the prospective. You can look further when you talk about the longitudinal study. Okay, then we have we can group the research according to our approach, okay, or the type of the design. There are three main types, but there are basically two main types of approach, which is quantitative and qualitative. The outcome, yes, but it is basically two main types, which are quantitative approach and qualitative approach. Now, what I explained initially, all those other retrospective or prospective or basic research or applied research, they can be grouped into quantitative or qualitative approach. Am I still on?
Yes, ma'am.
Yes,
Okay.
ma'am.
Thank you. If you have any question, you can just pause and I will attend to it. All right. So in quantitative research, the study is directed at discovery of relationship or cause and effect. I usually use this illustration. Okay, let's say in quantitative research, you look at numbers. In qualitative research, you look at quality. Okay? In quantitative research, you look at numbers, you are objective. In qualitative research, you look at quality, you are subjective. Because in qualitative research, you are basically saying that the truth is based on what you have told me. It is not objective. It is directed towards the meaning rather than the cause and the effect. We look at the effectiveness when we talk about outcome research, which can be basically also a quantitative research. So when we talk about quantitative research, all right, you have different concepts. These concepts are also in qualitative research. Like I told you, remember I told you that the steps are the same. However, it is applied in different ways depending on the kind of research that you want to carry out. So you have the subjects, okay? That is the main thing you want to study. You have the study participants. You have the respondents. The respondents are the people that you share your questionnaires to. You have your researcher. Sometimes in quantitative research, we call them investigators or the scientists, or the concepts that you are looking into, the constructs, the variables, the theory, or the theoretical framework, or the conceptual framework, or the data and the numeric values that you get. These key concepts are always in quantitative research. In qualitative research, you have the study participant here, but your data, instead of coming in form of numbers, it comes in forms of narrative. It's a story. Remember I told you, it's subjective. It's dependent on what I say or what you say. You have the researcher. You also have the phenomena that you are studying. You are studying about a particular phenomenon. Excuse me. You are looking at a concept and you are looking at the patterns of association. And so I'd like us to look at this and answer these questions quickly. You can type it in the chat. What names do we call a person who undertake a research study? What names do we call them? What names do we call them? Researcher, okay? Researcher, thank you. It's not a respondent. I saw somebody typing respondent. No, it's not a respondent. Respondent is the person that is answering your question when you share the questionnaire. You can also call them the investigator, okay? So now, the person who supply material or data for a research study are called so many names, okay? Now, in quantitative research, they are called what? In quantitative research, I'm actually looking at the chart. In quantitative research, they are called what? In quantitative research, they are called respondents, okay? While in qualitative research, they are called participants. In quantitative research, quantity, you are referring to them as your respondents, all right? But in qualitative research, you are referring to them as your participants because you are dialoguing with them, you are discussing with them, or you are observing them, as the case may be. But in your quantitative research, they are actually responding to your question through a survey, all right? So in quantitative research, you have the respondents, But in qualitative research, you have the participants. Please, I usually see that students make a lot of mistake with that. Okay. However, when you are conducting a quasi-experimental research, okay, you can refer to your subjects as the participant, depending on the kind of depending on the type. Am I still on?
No, ma, your screen has gone off.
Your screen is off.
Yeah, I noticed that it went off. That's why I'm asking that am I still on? I'm so sorry. All right. Is it back on?
Yes, ma.
Okay. So let's quickly continue with our question. So what form do data take in quantitative study? What form do data take in quantitative study? What form do data take in quantitative study? Numerical, numbers? Thank you. Thank you. You are following very well. What about the qualitative studies? What about the qualitative studies? Narrative, okay. Narrative, thank you. Thank you so plentifully. Thank you so much, okay. A phenomenon, okay. It can also be named, it takes the narrative form, a phenomenon, okay. All right. So, I want to see, sorry, I think something went wrong. Yeah. So when we have, well, let's come back to class. Thank you so much. I see that you are following and I'm grateful for that. When we want to conduct research, if I may ask, I'm your supervisor and I want to I want you to come to me. I'm supposed to supervise you. Where should we start our discussion? I would like us to type it in. Where should we start our discussion? From our topic or from our statement of the problem? From our topic or from our statement of the problem? If you say topic, can I see you say yes? If you say topic, can I see you say yes? Okay. I see people saying yes from topic. I wish I could do a polls. I wish I could create a polls quickly. I wish I could create a poll quickly. If you say a statement of problem, let me see you say hi. If you say statement of problem, say hi. Okay. Thank you so much. Well, your research actually starts from the problem. Your research actually starts from the problem, not from your topic. Most of the time, students usually want to go to the internet. In fact, these days that we have AI, they want to just go to ChatGPT and talk to ChatGPT. ChatGPT should just give them a topic and then they come and give me the topic and I say, what is the problem that you want to solve with this topic? Remember that when you want to conduct a research, it starts from your where? It starts from where?
Problem.
from your problem, from your reasoning, from your seeing, seeing that something is wrong somewhere. You are seeing a problem. You are seeing that there is a problem, and you are telling yourself, this should not remain the same. And then you want to solve the problem. And so you can't start by bringing the topic. I want to emphasize this today, that your topic or your title is the problem, the solution that you are bringing in to the problem that you have identified. So if you are starting from the solution and you do not have a problem, don't you see that that is going to be a problem? That's a problem on its own. And so when you want to start a research as a researcher, you are looking at problems that are in existence, and the problems can come from different places. You may even decide, I've been asking students this question anytime I teach them, foundation of nursing. When we are talking about wound dressing, okay, they will say that you should switch off the fan, you should close the nearby windows, and I ask students, why do they say that? They say you want to prevent infection. And I still ask them, but wounds in the hospital still come down with infection. So why? So why is it that there are still infection with, when we have closed all the windows and all that? Don't you think that we should research into it? Then I asked, I was fortunate to teach some group of students that are not necessarily trained in Nigeria. They are not from Nigeria, but they are studying here now. They are studying their masters. And then I asked the question. I said, if you want to do your wound dressing, do you close your windows? They say no. Do you switch off your fan? They say no. Then I said, how do you create a sterile environment? They say, you need to create that sterile environment from your trolley, from the tray, and at the bedside of the patient. Then I said, that's an interesting way to look at wounds in Nigeria. How long do they heal? Wounds outside the country, this particular country, how long do they get to heal? Okay, that's a problem on its own. And so we talk about, so when you are thinking of research as a researcher, it starts from your reasoning. Your eye should be sharp enough to see problems and to see solutions as well. So I have said, how do we identify problems? Process of identifying problem. Remember that there is always an ideal situation. There is always in this picture, I want somebody, if you could unmute yourself. What is in this picture? What's in this picture? If you could unmute yourself. Am I still in class?
Yes, ma'am.
Yes, you are.
Okay, so what's wrong with this picture? So what's wrong with this picture? What's wrong with this picture?
You are seeing like an individual going for a different, how let's say, a different definition of something, or giving another a different pattern of something apart from others. The yellow people choose the same patterns together.
Okay. I said recognizing the ideal situation. So in this picture, what is the ideal color?
The ideal color.
Yellow.
Yellow. Thank you. And then there is something else there. What is the something else there?
It's red.
One different color, red.
There is one different color, red. And then you start telling yourself, why is it red? Or can it be that the red is the ideal situation, and then all these yellows are the ones that are not the ideal situation? So when you are talking about a problem, when you are trying to think about a problem, you have to put at the back of your mind, what is the ideal situation? What is the what? Ideal situation. And so, for instance, like I tell you, let me continue with the illustration of wound dressing. In wound dressing, the ideal situation when you want to clean the wound of a patient is that you must create what?
A sterile environment.
Thank you. You must create a sterile environment. You must create a sterile environment. But you have noticed that even while we create the sterile environment, or supposedly create a sterile environment, there seems to still be a problem. And so whatever your work that you are looking at, you must always remember, what is the ideal situation? What is the real thing that should be there? But you have to be realistic of what is the current situation. The current situation is that we still have wound breakdown in the hospital. But now, when we say we still have wound breakdown in the hospital, there are so many dimensions to how this wound can break down. What is causing the wound breakdown? Could it be the fan? Could it be the instrument? Could it even be the person? Or could it be the nurse that is introducing the microbes? What can it be that is causing? And that is where we have the problem tree. Are you seeing? Okay. That is where we have what? The problem
tree.
You know, when we look at the tree outside, when you look at a tree outside, you know, we see the leaves, we see the fruits, we see the branches, but do we see the roots? No. Most of the time, we do not necessarily see the roots. And so, when you look at, let me just go back quickly. Like I told you here, in the realistic situation of the current situation of the wound dressing, I told you that there can be so many dimensions to why there is wound breakdown. Now, that is where the problem tree comes in. We are seeing the wound breakdown. Okay? We are understanding the wound breakdown. Those people that are receiving the direct impacts of the wound breakdown. The parties that are involved. Who are the parties that are involved? The nurses, the patient, the family members of the patient, the doctors, and the other nurses and the other patients that are there. The main problem that the beneficiaries suffer from, the problem position, and then the main causes of the problem. Now, I told you that under the main causes of the problem, those are the different roots. Okay? Those are what? The different roots. Under each root, it can either be, okay, it can be the problem from the nurse. It can be the problem from maybe we are not actually sterilizing the instrument properly. It can even be a problem from the patient. Maybe the patient is diabetic and we did not know. Maybe the solution that we are using, the patient is reacting to it, we do not know. Maybe even though the patient may not be reacting to the solution that we are using, maybe the plaster is what the patient is reacting to. And so you look at the different roots the different roots of the problem. And so when you're saying that you are looking, one of the problems I usually encounter with students also is that they come with compounded problems. Compounded problems. It is true that they have written a problem statement, but by the time you read the statement of the problem, you find out that there are so many dimensions to it, and then you ask them, which of these dimensions do you want to solve? Okay? That is why I said you must be realistic about the solution, that the reality of the problem and the solution you want to bring out. And so you just pick one root, just like the roots in this tree has so many dimensions, has so many problems. So also, and we cannot deal with all the problems at once. So you just pick one of the roots, and that is what goes to your solution, and that is what goes to your research objective, and that is what goes to your specific objective and your research question. Now, arriving at a solution, suggest your research title. Just like I told you, teaching the mothers, the grandmothers what breastfeeding is all about. Teaching the mothers themselves to learn self-efficacy in actually carrying out the breastfeeding, because I have noticed that mothers don't necessarily know how to put their babies to breast, and because they don't know how to put their babies to breast, they say, my baby is not getting enough milk, and they stop. And so I decide that, which one do I really want to do? Okay, then I tell myself, I think the best place to start is with the mothers themselves. They have to, first of all, understand. I have to teach them positioning of the breastfeeding, of the breast very well, so that they can have good let down reflex, and their babies can suck very well. So that means that the solution I'm looking at is that I'm looking at not only I'm looking at teaching the mothers on how to latch breastfeeding position. So I say that I want to do an educational intervention on breastfeeding positioning, okay, for new mothers, primigravida mothers. So that is my solution. And from there, I'm going to have my broad objective. And then from there, I'm going to have my specific objective. And then I will have my research questions. So on my slide, I have said I want to do something on breastfeeding. Now, you will see that on this slide, there's a picture of multiple roads, many roads leading to a particular place. There are so many roads, but I have to go to a particular place. And for me to make my choice, I have to put these following things into consideration. So I would like to say that objective is the road to bringing the solution. Objective is the road, the path which we take in bringing the solution to the research problem that you have identified. Okay, but I cannot decide to go like this, all the roads. It will lead me to nowhere. And that is why, for me to have good objective, I must be specific I must take a particular route. I must decide what I want. So when you are writing an objective, you need to be able to say that it is, I am having a specific objective. In my objective that I'm writing, it is measurable. If I pass through this straight road on the picture here, I'm going to get to where I am going to in 15 minutes. So it's the same way when I'm writing my objective, I should be able to say what I want to measure. I should be able to use good verbs like assess, describe, explore, or determine. And one thing about writing my objective is also dependent on the type of study that I am engaging in. And so I must write my objective such that it will be achievable. Not just that it is achievable, it is also realistic and it is time bound. Usually we say it is smart. Okay? So, there are so many sources of research problems in nursing. We say we have our experiences, we have our clinical practice, social issues, nursing theories, collaborations, and funding priorities. And so when I want to write my research objective, it should look like something like to describe, to determine, to examine, or to determine the effect that is now in my breastfeeding situation. I want to be able to determine the effect of my educational intervention on the outcome of breastfeeding, because I have taught mothers on the different types of breastfeeding positions. So when I'm writing, I have to write with specific verbs in mind to describe or to evaluate. If I am actually evaluating, there are specific verbs that I have to put in mind. Okay? So, let me quickly ask this question. The feasibility of conducting a study is determined by examining which of the following, even though the answer is showing already anyway. Availability of studies, availability of the subject, previous studies, research, credibility, significance of the research problem. What do you think should determine the feasibility of my study? I will answer your question. I can see a question in the chat. I will answer it quickly. What should be okay, somebody said number 2, because I said the answer is showing already. Okay, somebody said number 4. Somebody said previous studies. All right. All right. It depends on what you are studying. It is not necessarily previous studies. Okay. Yeah, somebody said availability of subjects. Now, I just want to quickly say that when you are studying, all these answers are correct. All of these answers are correct. However, it depends on the kind of study that you want to engage in. Remember, I told you that you should talk about delimitation and limitation. Now, if I want to if I want to study lupus in Nigeria, for instance, let me say lupus in Ogun State. Do you think it's going to be very easy for me to study lupus in Ogun State? Do you think it's going to be very easy for me to study lupus in Ogun State?
No, ma. No.
No.
No, ma.
No, but if there is a building if there is a center where they are keeping people that have lupus and I want to use that center, do you think it will be easier for me to study lupus?
Yes, ma.
Yes, it will be easy. So, feasibility of the study is dependent on the kind of study that you are actually conducting. Okay? But the most visible answer is the significance of the research problem. Is the significance of the research problem. However, number 1 to 4 is very correct. All of them are correct. The availability of the subject, the previous studies, have they studied this? If they studied it over and over and over again, do I need to do it again? Do I need to study it again? No, because I can easily go to the internet, review literature, and get answers to my problem. Researchers' credibility, if I don't have the expertise to study to conduct the study, do you think it is going to be feasible? No. And so as well as the significance of the research problem. So let me quickly answer this question. Somebody said, can we use to evaluate? Yes, you can use to evaluate. You can use the verb evaluate. You can use the verb identify. You can use the verb determine. But it's all dependent on your work. Now, I have to choose because they gave me a line of study what you are supposed to learn, but I have to choose picking on the very important one. But I just want to quickly chip this in that you have what you call exploratory studies. You have descriptive studies. Okay? You have experimental studies. You have analytical studies. So if you are doing an exploratory study, for instance, you are just exploring, you are just identifying. If you are doing a descriptive study, you are also just describing, you are also just identifying, you are only just assessing. Okay? So the type of study that you are doing, the person that is asking, can we use? Okay? Somebody is saying, what is the implication? What is the implication of this verb? Yes. This verb, like I said, the type of verb you use determine the kind of study. Remember, I told you that there are different classifications of research, but we have the major types that we use: the qualitative and the quantitative research. Now, when you have the quantitative, quantity, remember, quantity, numbers, you are actually trying to assess, you are actually trying to describe, you are actually trying to identify, you are actually trying to investigate, okay? To investigate, even though when you use the word investigate, sometimes you are also talking about experimental studies. So the kind of research approach, the kind of research design you use determine the type of verbs that you use for your study. Okay? So somebody is asking, supposing I want to do an association. Yes. And so you can use the verb to determine the relationship. okay, or to determine the association. All right. So it depends on the type of study, whether it is correlational study, whether it is exploratory, whether it is exploratory can either be quantitative or qualitative. Okay. But if it is most of the time, when you use the word explore, you're actually looking at qualitative research. Okay. So, like I said, the kind of verb you use determine the kind of study that you are actually undergoing. Now, I want to talk about variables because I'm supposed to explain to you how to write your research questions. All right. Before talking about research question and research hypothesis, let me just quickly go back to saying that when you have your research question, it must tally with your research objective. It must tally with your research objective. Okay, I'm going to go there. There are this on this screen. You can see the different types of variables: depression, hunger, age, loneliness, gender, affect, apathy, hair color. If I'm to ask you the different types of variables that are here, you will come up with different things. Okay. But when you are talking about your research topic or even your research objective, you have there is what you call the dependent and independent variable, extraneous variable, and all that. But variables are qualities or properties or characteristics of people or things or situations that are manipulated or that you want to measure in your research. You can measure them with an instrument or with the intensity of a scale. Now, you will notice that most of the time, they will say you do not have, they will say that you don't have independent or dependent variable in your research title. They will tell you that your research title is empty, is monosyllable, or is monovariable, because your research title is not showing what the dependent or the independent variable is. So there are different types of variables. Like I said, we have the independent, we have the dependent variables, we have the research variables, we have the extraneous variables, and we have the demographic variable. Now, I will just quickly talk to us about independent and dependent variable, and I would like maybe 3 or 4 persons to type their research title, and then they will tell me what the dependent or independent variable is. So when you talk about the independent variable, is the stimulus or the activity, okay, manipulated or varied by the research to cause an effect on the dependent variable. They cause change. They are controlled. Okay? The dependent variable may also be called the treatment or the experimental variable. That is, it is independent. It can stand on its own. Can stand on its own. The dependent variable, meanwhile, is the outcome variable. The dependent variable is the outcome variable that predicts or explains. The changes in the dependent variable are assumed to be caused by the independent variable. Okay? For instance, if I say that students who have good sleep, listen very well. Students who have good sleep have good grades in their courses. What will be the dependent? What will be the independent variable?
Good grade is independent.
Yes, you said?
Good grade is the independent. Good sleep is the dependent variable.
Okay. Why? Hello?
Yeah, because it's the quality of their sleep that determines their grade.
Okay.
Outcome.
Remember that the grade, okay, is the independent, and the independent is the one that the independent is the one that you are manipulating, and the dependent is the one that is the outcome. So in the story of I just said students that have good sleep will come out with good grades. What is the outcome variable?
Good grades.
Good grades is the outcome variables. So what will be the dependent variable then? So from what you have just said now, what is the dependent variable?
Good sleep.
Good grade is the dependent variable, okay? While the independent variable is the sleep. Is the sleep. Is the sleep.
Is the sleep. The more you
It's the
sleep, the
sleep.
more you.
Because with the sleep you are what? You are manipulating. That is the sleep that is causing the effect. All right. Now, but in the same thing, there are what you call extraneous variables. They are what you call what? Extraneous variables. Even though the students may have good sleep, the students may not come out with good grades because there are variables that may be causing distraction. Okay? These variables may interfere with obtaining an understanding of the relationship or the course in a study. So extraneous variables can be recognized, or it can be controlled, or they may also not be recognized and they may not be controlled. In sleeping and having good grade, there may be extraneous variables. There can be different types of extraneous variables that may be controlled. For instance, student attendance in class, students having the complete notes. That's an extraneous variable. Student inadequate reading materials. Okay, those are, thank you, you are following. I'm grateful that you are following. These are extraneous variables which you can control. But what about the extraneous variables which you cannot control? Like, for instance, the intelligence IQ, the intelligence coefficient of the of the person. If you like the person should sleep. If the person is not a naturally, in quotes, smart person, even if he has all the books and all the things, he may not necessarily come out with good grades. The age, family issues, you may be able to control family issues, but you may not be able to control the age. Okay, you may not be able to control the age because somebody is growing. There's nothing you can do about it. Okay, so when you are not able to control it, or you are not able to recognize the variables, it is known as the confounding variables. So in your study, it is very important to understand that you may not be able to understand, you may not be able to see the confounding variables, but you must make room for the compounding variables because it can affect how smart or not smart your objective or your research question is going to be. Okay, it can affect how smart or how not smart your research question is going to be. So we have what we call the demographic variables. So in demographic variables, you have age, education, gender. All these demographic variables, they are constant. They are constant in your research study. Whether you are doing qualitative, whether you are doing quantitative, whether you are doing experimental or non-experimental, they are constant and they are always there in your research variables. All right, in your research, in your study that you want to carry out. And so, when I want to write an hypothesis, okay, sorry, before I get to the hypothesis, I said that I asked us that I would like 3 or 4 persons to tell me their research study, their title, what the independent variable is, and what the dependent variable is, and then we are going to be able to extrapolate the extraneous variables that may be there or the confounding variables. So you can just somebody can just type in the title of the research and then tell me, thank you so much, I love this. Assessment of pain management method used. Okay, this is sounding like a statement already. Assessment of the pain management used by midwives during labor and delivery in Mother and Child Hospital, Akure. Dependent variable, pain management. Independent variable, methods used. Okay, I don't know who this person is, but let's quickly discuss your work. You said assessment of pain management method used by midwives during labor and delivery in Mother and Child. What is the outcome of your study? What is the outcome of the study? What's the outcome of the study that you want, that you are trying to get?
Pain management, ma. Like, what is the pain for the mothers during delivery? Easier method that is the pain for the mothers.
Okay. Because I feel that what you are just trying to, you are only having, it's only one thing you are looking at. It's a mono, you have only one variable, and that is pain management methods. I cannot really see the outcome, okay? I can't really see the outcome. You are just trying to quantify the different types of pain management methods that are being used. So you see, that is why it is very difficult. You are saying methods used by midwives, but you are saying pain management methods. You see, that is why it looks like it is overlapping, because there seems to be no real outcome. Okay, we'll look into that. Okay, so let me look at the next person quickly. Says predictive impact of intimate partner violence and depression among pregnant women. I like this. Now, this person, I really love this. Predictive impact of intimate partner violence and depression among pregnant women. I love this. So what is the independent and what is the dependent variable? The person didn't type it. This is I'm wearing my glasses. It's Bossede. Yes, Bossede Adejumo. So tell me, what is the dependent and independent?
The independence is predictive, the intimate partner violence and depression.
No, you have only one. Try it again. And then you have an outcome.
Okay, intimate partner violence.
What is the outcome?
Depression.
Depression. Thank you so much. So the independence is the intimate partner violence, and then the outcome is, that is, women that are suffering from violence may end up having what? Depression. Or they may not even have depression. That's what you want to tell us. Okay? I love that. All right? Knowledge and compliance with dietary recommendations among type 2 diabetic mellitus patients. Knowledge and compliance with dietary recommendations among type 2 type 2 DM patients attending medical outpatients. The way your work is written as if you are looking at two independent variables, that is knowledge and compliance, not knowledge on compliance. Did you get me? So it is looking more like you are looking at two independent variables, all right? Not necessarily, you are saying dependent is compliance, but the way you have written it is not necessarily written like that. Let me quickly use this to explain something very well now. Now, you see, when you write your research topic, your title, you should go back to your problem statement. To your tree. You should go back to your tree. My time will almost, I have just 5 minutes. I will try to round now. You should go back to your tree, okay? When you remember that I told you that there are so many roots in the problems. For the person that is talking about diabetic type 2 mellitus patient, she has seen that they don't necessarily comply. Why is it that they don't comply? Or why does she think that they don't comply? It is because she has seen that, I'm just assuming anyway, they are coming down with a lot, they keep coming back to the clinic. Their wounds probably are not getting healed. Their sugar level, their glucose level is always on the high part. And so she has seen that they are not necessarily complying. And then she has decided that, okay, maybe the reason why they are not complying, it is because they are not having good knowledge. So now when you say knowledge, when you now say knowledge,
and compliance. She has put it together. Hello, Ma. Is Dr. Nakuru there? Hello? I think her volume is off.
Yeah, I think her phone went off or something. The laptop is on, but the phone is off.
Okay. So let's just give her some time.
All right. While we wait for our facilitator, please check the chat session for the feedback form. Note that it will also serve as your attendance for this class. Please do fill the feedback form.
Sorry, my phone went off. Am I audible now?
Yes, Ma.
I'm so sorry. I'm very sorry. I don't know what went wrong with the network today. I'm very sorry, please. Okay. Yeah. So when you are when you are trying to write, you must understand what is the anticipated outcome that you are looking out for, so that it will reflect clearly in your title. For instance, I'm looking at one title here right now. It's saying assessment of influence of audio visual aids on study effectiveness. This is compounded, and academic performance of nursing students in UCH. Okay, this person wants to look at influence of audiovisual aids on study effectiveness and academic what? Performance. So what is going to be our independent study, our independent variable? Our independent variable, she said, are audiovisuals, thank you. And the dependents are study effectiveness and academics. Very correct. All right? Very correct. So when you want to write your research objective, for instance, your general objective is just your title in form of a question, in form of an objective. That is your general objective. So for this person now, this person is saying that he wants to assess, okay? He wants to assess the influence or the association. Is the association, okay? The association between audiovisual aids and study effectiveness and academic performance of nursing students in UCH. Okay, so I will just quickly stop this. I would have loved to analyze everybody's what.
Hello, Ma.
Yes, ma'am.
There's a topic, there's a title immediately after that. I think it will be important for them, for the sake of learning, to look at this person's title.
Okay.
Lokwe Abigail.
All right, ma'am.
Then we
Okay.
still have about I think because of the delay, we still have about 17 more minutes because they're supposed to ask some questions and interact with you.
Hello.
We can hear you, ma.
Okay. I was asking Titilope Abigail. I said CKD is chronic kidney disease. Among women attending Lautech teaching hospitals. Okay, so when we talk about that's a good one there. Okay, she's looking at male involvement in antenatal care. What will make them to be involved or not to be involved? Okay, among women. That is what my husband, why would they come? Why would they not come? That's where I'm seeing it. Okay. Attending Lautech teaching hospitals. Now, I said I've almost forgotten. I said we are going to be able to think about extraneous variables and confounding variables in some of these things, so that when we are doing when we are conducting our research, we'll be able to, from the beginning, start thinking, what are the things that may interfere with my collecting data or not collecting data. Now, let's use, I have 17, I will go down now. Let me quickly go down and see. There's another challenging topic here. Assessment of the nutritional status and financial coping strategies with dietary balance among undergraduates of achievers. Assessment of nutritional status and financial coping strategies with dietary balance among undergraduates. Are you trying to say that nutritional status and their financial coping strategies will affect the dietary balance? Or you are trying to say you are looking at these three things independently? Miss Omomowo Similoluwa. Is it Omomowo or Omomowo?
Ma,
I'm hearing.
Continue, Simi.
Ma, can you hear me?
Yes, ma'am.
Yeah.
I'm trying to look at how the financial coping strategies, like how they maintain their finances and the nutritional status of each student, and how it affects their dietary balance. Because when explaining, most students they prefer to manage their finances, their funds, and I want to know how it affects them, their balance, and how it affects how they eat as a student.
How you have written this now, do you think that it is telling you the outcome? You are taking the dietary balance as the outcome, but you are saying with, the way it is written, nutritional, let's leave the assessment out of it. Just nutritional status and financial coping strategies with dietary balance. It looks as if you are just looking at nutritional status, financial coping strategies, and dietary balance. Nutritional status and financial coping strategies on dietary balance among undergraduates is more talking about the way you have written it now as a dependent. But now let's think. So if I have tried to refine it, instead of saying with, I just put on the dietary balance. Okay?
Financial coping.
Okay, ma. Thank you, ma.
Okay? And now, let's now think, what can be the extraneous variable or the confounding variable in this your research? Or I'm asking everybody now, you can type it in. What do you think can be the extraneous variable? What do you think can be the extraneous variable? Remember that when you put all this into consideration, it will help you to know, how you want to rephrase or phrase your objective and your research questions, as it were. Thank you. Inadequate knowledge, all right? Financial status of each person may be different. Thank you. What about cultural taboos? Thank you so plentifully. Okay? The academic loads may be different. Okay? They may be totally different entirely. Okay? How the person is able to manage funds. So now, when you want to write your research question, how best do you think you can bring this in such that it's not going to be an extraneous variable to you? Because all these things you are calling, you can actually manage them. All right? You can actually manage them. So how do you think we can write? So in other words, when you are writing your objective, you are going to be writing these objectives. You are going to be putting these extraneous variables as one of the things you want to get answers to, such that you will be able to get the relationship between those that have good financial base. For instance, those that their parents are all well-to-do, and perhaps you want to ask what you want to assess the relationship or the influence of the income of the parents and the dietary intake or the dietary balance of the students. All right. So you are going to be bringing in. You are purposefully going to write this into a research question so that you are getting in the answers and it will not be an extraneous variable to you. All right. Now, I'm just going to quickly go back to my slide and then I'll just finish it up and then we can ask the questions quickly and then we can, yeah. So, all right. So, I just want to quickly say this lastly. When you want to write your hypothesis, these your extraneous variables, they also form part of the things that you bring in as your assumptions, okay? They also form the foundation or the basis of your assumption. Associative versus causal, non-directional versus directional. That is like that person looking at nutritional status now. You can give a direction to it to say that the higher the income of the parent, the more stable the dietary dietary stability, okay, of the students. All right, you can have so when you talk about associative, simply says that there is a relationship. That is, there is a relationship between the X and there's a relationship between the Y. Okay, like we were talking about the sleep. Okay, now when we want to talk about the association between good sleep and good grades, now we are bringing the extraneous variable. We purposefully bring it in to say that there is no relationship, okay, between good sleep, academic performance, and the IQ of the person, of the student. Now, causal states that there is a cause and effect. That is, when you do this, this is going to happen. Like I explained, non-directional states that a relationship exists, but does not further describe the nature, okay? But does not further describe the nature of the relationship. But directional hypothesis tells us that there is a relationship, and it tells us the nature. If I increase this, this will increase. Like the person talking about nutrition, like I was trying to use the financial status of the parents will have an effect on the stability, the dietary stability of the patient. I think this is where I'm going to end, and then I'll ask question after the null versus research hypothesis. Now, the null hypothesis states that there is a relationship between variables, also called statistical hypothesis. And, you know, this is where I don't want to go into it because of our time. This is where your significance of the level of significance comes in. And this is where we can either make different kinds of error, whether the type 1 or the type 2 error. So where you accept where you are supposed to reject, or where you reject where you are supposed to accept. So a null hypothesis states that there is no relationship between variables, and the research hypothesis says there is a relationship between. So most of the time, what we write is the null hypothesis. We write the null hypothesis because you cannot have an alternative hypothesis when you have not tested the null hypothesis. Dr. Otitodoju, I think I want to ask students questions. Maybe if there is okay, somebody is asking a question. So if there is a question, we can go ahead to ask. But let me just quickly say this. An hypothesis should be testable. The variables that are to be measured are clear and can be manipulated. Okay, and can be manipulated. That's where the extraneous variable comes in. You cannot manipulate the confounding variables. All right. Relationship between variables are supported. Okay, and there is a causal link between the dependent and the independent variables when you use a statistical test. When you use a statistical test. So let me quickly answer the question. So research hypothesis is the same as alternative hypothesis. Yes. Thank you. Dr. Otitodoju, I think.
Let's ask our questions now quickly before let's ask our questions, and as we also fill our feedback form so that Dr. Anokuru can see our feedback, and let's send in all our comments as we're about to round up. Let's send in all our comments. Any questions? So does that mean that everything is clear cut?
Okay. Somebody is asking me, what did I say is wrong with our topic? I don't even know what your topic is. There are so many topics I just skipped. I don't know what your topic is. Maybe I can search it and maybe I'll find it. So I don't know. But let me just answer this question.
The first person to post a topic.
The first person to post a topic. Okay, I will check. I'll look for it. At what level of significance can we reject the null hypothesis and accept the alternative hypothesis? Okay. Now, let me just say this quickly, that when we are doing an experimental study, like in human study, we usually set the level of significance at 0.01. Okay. We look at the confidence interval. We want as many persons inside that dumbbell shape. We want as many persons inside. So we want everybody to be inside. are like 99%. And so we have the extremities to be at 0.01. Okay, that is when we are doing human, like you are testing drugs, like you are testing maybe like in the issue of the dressing, okay, dressing of wounds. But when we are doing like a survey, okay, we say we want at least the confidence interval to be like 95%. So we say that we have it at 5%. So we have it at 0.05%. So you cannot, so as if you, there are so many things that are dependent on whether you want to reject or you want to accept. And that is also dependent on the kind of research design that you use. If you do not have, if you have not used a correct research design, you may be accepting an hypothesis when you need to reject it because you have not attacked the problem rightly. You may have attacked the problem rightly in the terms of research design, but because your sampling is wrong, and that is where your sample size is very important. The sampling technique that you use is also very important. So if you have used a small sample size when you need a bigger sample size, you may be having this problem of accepting when you need to be rejecting or rejecting when you need to be accepting because you have not actually used the correct sampling size or you have not actually used the correct sampling formula. So you have a small sample size when you needed a bigger sample size, or you have a bigger sample size when you needed a small sample size. Like some instances where students will use Cochrane formula when they're doing an experimental study, or when they are comparing means and they are using only the formula for having only one mean. So yeah, so rejecting or accepting a research hypothesis, it's more complex than me just telling you it's based on 0.05 or based on 0.01. However, if it is a research for testing human beings that we want to be precise as much as possible, we use 0.01. But if it is a survey, we use 0.05. We say 95% as much as possible. Okay. Then so that's that about now let me just give a general overview about topic because some people are asking what should I do about my topic. Let me just give you a general overview about topic. 1, don't start your research with a topic. Start your research, look at the problem. What is the ideal situation? What is the realistic thing? What is the consequence? Now look at the problem tree. Who are those affected? Different levels of effects and the different causes. When you understand the different causes, you pick one, just one out of that root that you want to solve. When you have picked one out of the roots that you want to solve, and then you will now tell yourself, what will be my manipulating variable? What will be my outcome variable? If I manipulate this one, what will come out this way? Or I don't want to manipulate any variable. Maybe I just only want to describe. There's no problem with that. Maybe I just want to describe the situation that is happening. I just want to do a descriptive study. There's no problem with that in any form. So you have to understand the problem you want to solve before before you have a good research title. However, let me use the Nursing Council standard. Nursing Council wants you to have independent and dependent variable. So a very good research topic in quotes as per Nursing Council is that you must be able to identify your independent variable and your dependent variable. You must be able to identify it clearly. And you must be able to identify on what population, okay? On what population am I carrying out this research? And again, when you are doing a qualitative research, your qualifier, okay, the verb qualifier will tell you out whether you are doing a qualitative research or you are doing a quantitative research. For instance, if I'm conducting a lived experience, Nursing Council, in quotes, mind me that I'm saying in quotes, they, in their marking scheme, they say, they want to mark you on hypothesis, they want to mark you on, did you state the right hypothesis? So if you are doing a qualitative research for Nursing Council, they're already missing it out on the quantitative, on the hypothesis, because you will never have an hypothesis in a qualitative research. So, in other words, Nursing Council is restraining you to having quantitative studies, okay, in quotes. However, if you have an examiner that maybe that understand research, will see that, okay, once you are doing a qualitative research, you may not have you may not have an hypothesis. So, for instance, let me now go back to the title. If I say I am conducting lived experience of working mothers on exclusive breastfeeding among mothers in Ogun State. Okay, already from the title, you already have an idea that it's a qualitative research. But if I say I want to do knowledge, attitude, and practice, okay, or the knowledge, attitude on practice of exclusive breastfeeding, okay, among women, among working mothers in Ikenne local government. All right, I had already defined that the fact that I'm doing knowledge is objective, it is not subjective. The fact that I'm doing knowledge has shown that I am already trying to do a quantitative research, not a qualitative research. So you must be able to understand that very well. So to have a good topic, you must have your independent, you must have your dependent, and you must have your population. Okay? When you are doing a scoping review, there's what you call PICO. Okay? They use that to formulate your research question, or PCC. Okay? That is, you look at the population, and you look at the concepts, and you look at the context of the study. All right? Then somebody else asked this question. Is it advisable to write on a research topic without much research articles on the certain topic? Yes. You see, I have a student, a master's student right now, that is, sorry, I forgot to charge my laptop. I just want to, just excuse me for 1 minute. I just want to put it on picture because it's showing me that it wants to go off. Because I've been using it since morning. Yeah, somebody said that, is it advisable for you to do a research on, is it advisable for you to conduct a research on a topic that have limited? Yes, it is advisable. I have a student now that is conducting a research, a groundbreaking research. And she said to me, there is no, there are no many literature review or literature on this topic. I said yes, but there are so many literature on postpartum hemorrhage. She said yes. I said, so attack it from postpartum hemorrhage, because you are actually only looking at the methods. So again, there is really, really nothing that is being done. There's no new research, as it were, that you don't have literature review. They may not have it specifically on that, your topic, plenty, many like that, but that does not mean that you cannot have, there's what you call synonyms, there's what you call, in medical words, they say the mesh language, okay, that you can look for similar studies that are into it. So don't tell me that there are no literature review. Like there are literature review, but it may not be centered on, and that is what makes your research novel. That's what makes it novel. That's what makes it novel. Okay, so you can do it. Okay, but there are other things around it that you can get answers to. So concerning limitation and delimitation of the study, should the limitation of the study be done in conclusion instead of putting it in the background? Yes, that is what I usually tell my students. Because delimitation, as in DELIM, is what should start at the background. Delimitation is at the back. All right? The limitation, because you cannot set out to start and start with limitation. How do you know you will find limitation? Then there's no need for you to do the study. The delimitation is where you will say, this is how far I want to go to. Okay? Yeah. So please, what is groundbreaking research topic? I don't know what the groundbreaking research topic is. Research can be novel. There are so many research that, the problem is that we are always looking at, we all want to look at it from the same point of view. But your minute point of view may actually be the novel part that is in it. Let me give you an example. My husband is a medical chemist, as in he is doing medicinal chemistry, natural chemist products, okay? And they were studying a particular plant in South Africa, and that plant was, I don't know, the name is Acalifa. I don't know, the name of is Combatacea something. So this plant, they have been studying it. They've been looking at it. And all of them have been coming up with the variation, this, that. Then my husband just decided that, okay, I'm going to look at, he just noticed that there are different patterns in the geographical, there is a geographical variation in how they respond to treatment and the different things. And he discovered that when in dry season, the way it produces the healing property is different from what it produces in the winter season. And it is also different from what is it in another location. Just minute difference. And that was the only thing he reported in a conference. And it was a big applaud. Just geographical location. And he just saw that there were differences. In other words, so that a plant may be growing in America does not mean that if it's growing in Nigeria, it's going to have the same healing property. That is just what it means. So groundbreaking research is all around you. Just open your eyes to it and decide to think outside the box. Don't think the same way everybody has been thinking. Just think outside the box. You'll find a groundbreaking research. Okay?
We're looking at time now.
Okay, ma, I'm going to stop now.
Save your questions, send it to your classroom. Your mentors will respond if you still have more questions. Because doctor has been working all day today. Today is not a free day for her.
Okay, can we have two problems from a research topic, like how a relationship between three factors? Okay. Even though I don't really understand what you're saying, but the person doing nutritional and financial and dietary patterns can be three factors. That can be 3 factors, and it can be 2 factors, and that's a relationship already. Okay, that's an example of a relationship already. I don't know, maybe I answered that person's question. Yeah.
Thank you very much, Ma. It's been an interesting and impactful, solid 2 hours. Thank you so much. And I'm sure we've all learned, and we are all beginning to see, we are having, more clarity. You see, many times, especially for those of you that have done 1 or 2 studies before, because of the loads of work you have to do because you are in nursing, you also agree that even though you have done it before, the more you learn, it's as if you are learning it afresh. There's something new. There is something new every time. That's the good thing about research. The more you do, the more you learn and you get better at it. So we are grateful for this opportunity. Thank you very much, Ma. Can we all appreciate, send out your chat, your love, and give out comments to show that you have learned one thing or the other. Okay. So thank you so very much, Ma. For those of you in class 1, that you have not been taking advantage of our presence, you are missing. And so we are going to be expecting, because we're supposed to be having our, what is it called? We're supposed to be having our class activity for the week. We've already done some of the activities in the group. So we'll wait for Dr. Nakuru to send us what she thinks we should do for the week. But before that, if I were you, those of you that you have itches with your titles already and all that, you can start posting into your group so that you can state your dependent variable, independent variable, or you can first of all identify your problems to your mentors, then now tell them this is the topic based on this problem, this is my topic, these are my, so that you can begin to play around with that before you get the activity for the week from Dr. Anokuru. So I expect this week to be a very interactive week. Thank you very much. Once again, Dr. Anokuru, thank you so much. We appreciate you, ma. God bless you. Thank you so very much.
Thank you, ma'am. I think one of the activities, the major activity, is for them to draw a problem tree. The problem tree for their research. Okay, there is a template. They can Google the template for the problem tree, and they should be true to themselves and look at the roots, and then they'll be able to decide themselves. Is this the appropriate topic for the problem? And then they'll be able to identify what is the ideal situation. But I'll write it out so that it can be clear to everybody. The ideal situation, the consequence, the reality, the consequence, and then my solution.
Thank you very much, ma. Thank you very much. So you've all heard that. So if we have any question, please, you can send to your mentors. We'll continue to push on in class. And at this stage, you know that for people who have not attended 3 consecutive lectures and have not participated effectively, we need to pull some of them out of the class at this point. The reason is because with this magnitude of lectures you are hearing, it will be impossible for somebody who has not attended any of the 3 classes to be able to catch up subsequently. It will not make any sense, okay? So we are also evaluating your behavioral pattern, also looking at how nursing students respond to mentoring programs, okay? So this will inform our decision on how we plan programs subsequently. So everything we are doing here, we are learning different ways. We are learning. Please fill your feedback form. If you have questions for Jerry and Tolu, they are always ready, 2410. And you know that I'm always ready 2410 too. For those of you that have received my feedback in different classes, you know that I'm always here 2410. So just feel free to chat with us. Have a blessed week. If you don't have any question, God bless us. All right. Jerry, Tolu, if you have anything to tell the class, over to you. If not, we can all exit. Thank you, everybody.
Thank you very much, ma. I think everything is good from my end.
Okay. Tolu, any comment?
No, ma.
All right. Thank you very much. Okay. God bless every one of us. So once you fill your feedback form, please, you can take your leave once you fill your feedback form. Thank you, everybody.